Growing Together in Diversity, Hospital Partners in Dialogue is the headline of the new live stream series of the Hospital Partnerships funding program. I welcome you warmly to this first session of this series called Advancing Mental Health, Mastering Crises, How Hospital Partnerships Can Contribute to this field, a topic increasingly relevant for all of us. My name is Miriam Wakili, and I'm very happy to moderate this event here in Bonn with our distinguished guests from Hamburg, from Nairobi, and from Baghdad. And of course, all of you joining us today in this YouTube live stream. The Deutsche Gesellschaft für internationale Zusammenarbeit, the GIZ, works for better health services all over the world. It is the German government's largest service provider in international cooperation that works to bring about sustainable improvements in the lives of people and societies on priority issues. The GIZ Hospital Partnerships play a special role in that. And let me just briefly describe this project. Our guests will do that in detail. So medical and health professionals from German institutions team up with their colleagues in low and middle income countries and hence form a hospital partnership. And these project teams work together on specialized medical trainings, further education, capacity building. The program is commissioned and financed by the German Federal Ministry for Economic Cooperation and Development and co-financed by the Foundation Else Kröner-Fresenius. So the GIZ program calls for proposals on a regular basis and supports the partners in capacity development. So if you're not a partner yet, please get in touch with the GIZ Hospital Partnership team and send your proposal to them, submit your application. The community of hospital partners is growing constantly, and today we will get to know 3 partners. I'm very glad that they're here. Joining us from Baghdad, we will talk to Assistant Professor Dr. Uday Khaled from the Medical College at Al-Nahrain University. A very warm welcome to you. We will meet each other through Zoom in this session. And also joining us in Zoom from Nairobi, we will talk to Virginia Mutheu. She's the project coordinator of Shining Hope for Communities, SHOFCO. In this organization, she is responsible for projects that strengthen the mental health of slum dwellers with the so-called garden method. And I'm very happy to hear more about this method. And today's studio guest here with me is Monika Blotevogel. She's a therapist and founder of the organization CORESZON in Hamburg. And you're the counterpart of the 2 partners.
Right.
Exactly. Before we delve into the topic of mental health, a little note to our viewers. You're very welcome to submit your questions in the chat. We will try to answer them here. Our guests will try to answer them, and also the team behind the scenes. Monika, before we talk about your organization that I just mentioned, CORESZON, I want to start with this headline that I mentioned before, Advancing Mental Health, Mastering Crises, How Hospital Partnerships Can Contribute to this field of mental health. Why is it such an important field, and what role does it play in societies?
Yeah, it's a great question to start out with. And, you know, instead of stating a lot of facts and figures, aside from maybe one, that mental disorders are the leading cause of disability worldwide, I'd like to really focus on, mastering crises. What does mental health have to do with that? Why is it so important? And I think we all in the past 2 years have had multiple opportunities to experience how essential our own well-being is to our ability to cooperate with others in our immediate environment, but also as large groups in society. And I think what we've been able to observe over the past couple of years during the pandemic is how anxiety and exhaustion can have a negative impact on our ability to work well together. And I think this is really showing us, this is one of the upsides of the pandemic, is it's really showing us where do we need to focus on in order to build back better, more cohesive and more just societies. And so I think our mental health is a really essential part of that, because the better that I'm doing socially, emotionally, in my relationships, the better able I am to work together with others to master crises.
Mastering crises, how can these hospital partnerships contribute to that?
So I think one, for myself personally, as a hospital partner in these two projects that you just mentioned with my colleague Uday, Khaled, and with Virginia, we really learn a lot about what it takes to cooperate from different contexts and to learn from each other. That's one way that I think this hospital partnership program definitely contributes to the quality of medical services, not only that can be provided in our partners' countries, but also here in Germany, because we also have a learning benefit from that.
And how did you get the idea of let's team up, let's partner, let's learn from each other? What was your motivation?
I think, so just to answer this from a more personal side, I've always been fascinated about what it takes to communicate, to collaborate across, different cultures. I come from a family where two cultures met, Scandinavian American and a Filipino side to the family. And I think from an early age on, I've always wanted to know how do we make it work? And just had so many examples for how misunderstanding and understanding can make things develop in a very, very fruitful way.
And as you said before, this intercultural experience is one benefit or one learning field. What else would you say is a benefit in partnering in that field of mental health?
Yeah, I think also having a closer look at, when you have the opportunity to work closely together as partners and learn from each other, and you're building up services, quite often you'll realize that the way that you're doing things at home could also use some closer examination, and that there might also be room for improvement there. I think that's another major opportunity that I see, at least in the field of mental health. Yeah.
And next week you will meet one of your partners. You will fly to Nairobi, right?
Exactly.
And in a few weeks you will also meet your Iraqi and Palestinian partners and colleagues in Turkey. So it's the physical meetings that also count and that are very important.
Absolutely. Yeah, being in the same room together and working intensively is a huge part of it. Yeah.
So with Dr. Khaled, whom we will meet in a few moments, you're involved in a training program in the field of child and adolescent psychiatry and psychotherapy, the so-called Curriculum Middle East. Maybe you can just give us a brief introduction. Dr. Khaled will dig deeper in that field, but what is it about?
All right, so Curriculum Middle East is about capacitating doctors, psychologists, and social workers from Iraq, from the Kurdistan region, and from Palestine to work as child and adolescent psychiatrists or psychotherapists. So it's a training program oriented to the German standards for child psychiatry training. That's delivered over a longer period of time. I think Uday will be talking more about that. But maybe just briefly, how did it come about? which is, as you know, I'm based at the University of Hamburg Medical Center, and together with a German NGO, Children of Baghdad, this project was actually founded almost 20 years ago. And the group that Dr. Khaled is in now is actually the third batch of trainees that have passed through this program. And I only joined it about 7 years ago too. So it's a project that's being handed from generation to generation.
And what would you say makes it a special project in that region, or for all of us?
Yeah, I think what makes it quite unique is the fact that we work together over a longer period of time. This is not just a one-off training. This is a 3.5-year at least program with 7 intensive blocks that cover the 3 basic pillars of psychotherapy training over time. So it's sustainable, and it allows room and time for development. I think that's one major point that discerns it from many other training programs that happen in contexts like this. So we do manage to achieve together, thanks to everybody who is involved, we do manage to achieve some sort of stability under constantly unstable conditions.
And this, in a few weeks, will be the last part of of
graduation
journey. Okay, I think Dr. Khaled is there with us. Hello, Dr.
Hello.
Khaled. Welcome.
Hello, Miriam.
Welcome.
Hello, Monica.
Good to see you. Good to see you. Before we start with your presentation and to hear more about the curriculum Middle East, it would be great to hear how diagnostics and therapy on mental illness work in Iraq.
Yes, actually, psychiatry here is based regarding the education. We have the Iraqi and Arab Board of Psychiatry, and they apply the international principles of education of psychiatry. So the diagnosis follows the international rules, following the 2 main rules for diagnoses, which are the international classification and the American approach according to the Diagnostic and Statistical Manual of the American Medical Association.
And Dr. Khaled, you've prepared some slides for us, a presentation to give us more information on the mental situation of youth and your program for us. I would be very happy if you could share your presentation with us now, and very curious to hear more about that.
Okay, thank you very much. So I will talk about the project Curriculum Middle East, which is a partnership project between Iraq, Palestine, and Germany. First, I will give you an idea about Iraq. Iraq, one of the Middle East countries. It is about 400,000 kilometers in area, and the capital is Baghdad. And there are about 40 million population. Most of them are of young population age group. And there are a lot of refugees, internally displaced people, and immigrants coming, or refugees from other countries because of the instability of the area. Psychological stressors for children and young adults during war and war-like situations for long time. There was always pressure to isolate children at homes, and school closures. There was school closures for long periods of time, even before the COVID-19 period. Fleeing and displacement, and living in difficult conditions, and experience of violence within families, and the work-like situations or violence of war operations. All these together with the dissolution of the social cohesion result in a climate of fear and a situation of loss of trust. On this base, this partnership program was established, and it includes a training program which is still continuously done at Turkey, Antalya, in cooperation with colleagues from Germany. And the training items, as you see, include lectures and workshops, lectures about the baseline techniques of interactions with patients and families and the circumstances of treatment, and together with overview about the main clinical conditions that are encountered in clinical practice, together with case reviews, and the case reviews are done in a way according to the German standards of the psychiatric education, which is concerned with the dynamic stance or the analytic stance of the clinical problems, together with focused groups, regional groups, which in which discussions about what is done on the ground for each of the trainees when they return back from the training blocks, together with group self-experience. And this is an interesting experience which is concerned with group members talking with each other in confidentiality, and it is aimed at ventilating themselves, the trainees ventilate themselves and understand themselves, and this help them understand their clients better. And this is again one of the aspects of the German way of teaching of psychiatry and psychotherapy, together with stress reduction classes. And these are done in two directions, either relaxation training or the CORESZON exercises, which will be talked about in more details by my colleagues, Monica and Virginia. So the goals of the Curriculum Middle East is to do training according to the German standards, and to focus on the dynamic aspects of treatment and diagnosis, and together with the aim of establishment of child and adolescent psychiatry and psychotherapy as a clinical specialty in Iraq, together with promoting awareness about mind and culture among stakeholders in order to establish more modern mental health services for children and adolescents. This is a photo of the trainees and the trainers. We have psychiatrists, social workers, psychologists, family doctors, and pediatricians among the trainees. The training is done to people who work in Iraq in a state in which there is political instability, there is difficulty of planning of the health services. Still, the vision is not clear about what kind of health services, including mental health services, to be implemented, together with difficulties with governance and the quality insurance at the level of health services and at the level of medical education. This is also accompanied by high levels of redundancy in the society, the youth having difficulty finding themselves in this world and having an identity issues that make them always under pressure and make them always unsatisfied with their lives and think always of immigration. Here, an example from the trainees who work at Imamain Domain Teaching Medical City, which is the teaching hospital of Al-Nahrain University, at which I work. And we have a team of 2 psychiatrists and 2 2 psychologists and 1 social worker were included in the curriculum Middle East. And you see here from the statistics that the number of personnel in comparison to the required, in comparison to the needs of the population is very little. We see that we have in our unit only 4 psychiatrists, 4 to 5 resident psychiatrists, and 2 psychologists and 1 social worker, 1 nurse, and we are serving an area of about 2 million people. So there is shortage of trained personnel to deal with the huge mental health problems that can be or possibly be present within these 2 million population in the area served by this medical center. And we have done an audit statistics to the work that we have done after we have been included in the curriculum Middle East. And from these statistics, it was seen that most of the patients are of the male gender, and this is almost like what is present in the literature, that psychiatric disorders in young children are more among males, and most of the cases are emotional disorders, and this is in comparison to the classical practice in psychiatry, where most of the cases are neurodevelopmental. And most of the patients consulted at the school age, and this is because the families start to consider their children's difficulties by this age. But one of the important points from this audit that most of the patients attended only for 1 time, and this is one of the difficulties that we face in implementing our knowledge and the skills, that people usually avoid consulting with the mental health services, and there is reluctance to follow up the condition they suffer from. And one of the lessons that we have learned, that we need more cooperation with our German partners, and we hope and plan to establish this type of training inside Iraq. The challenges that we face are too many, and actually there are many difficulties, including work organization and administrative procedures. And we as a psychiatrist face difficulty in establishing our specialty within other fields. In the current situation, there is always here priority to other departments, other fields, while we are trying to establish ourselves, and we try to make it clear that psychiatry and mental health is as important as other specialties in medicine. Again, one of the challenges is people awareness about mental health, and this is still low among people, and this what make them reluctant to consult and to follow up their condition and their children situation. And mental health as a valuable object. Again, we need to motivate people to think again that their life is valuable and they deserve to live in a healthy way. This idea is still not in people's mind here. They could not consider mental health as a priority in their lives. So this is a summary about, short summary about our project. Thank you so much, Miriam, and I turn back to you again.
Thank you, Dr. Khaled, for this very interesting introduction into your work that you're doing in Iraq. You said that the youth is having identity issues, that anxiety is there, the fear, what will happen in the future on the one hand, and on the other hand, there is a huge need for help in this field. So you talked about people's awareness that is quite low. How do you cope with this in your everyday work and to promote this awareness?
Yes. Actually, the task is not easy and the situation is not easy. If you see every psychiatrist here in Iraq, the number of psychiatrists in Iraq is not more than 120 psychiatrists all over the country. Each psychiatrist have huge responsibilities because of the huge burden on them, as there are great needs. But in the same time, we work, we want to improve the situation step by step. Our target, I myself as a psychiatrist, I want to establish a respectful quality of work that can attract clients and families. But this, again, this is done by most of all of my colleagues. But in the same time, there are many obstacles: administrative, organizational, people's awareness. It is not an easy task, but we need to keep on our momentum to improve it.
So, what do you think these hospital partnerships can help in what you just talked about, in promoting this awareness and the curriculum Middle East that you developed in that partnership? What do you think about that? Mm-hmm.
Yes, one of the targets of the project is to arrange public activities. And these public activities include courses directed towards teachers at schools or at people in various public sectors in order to improve awareness about mental health issues. And at the same time, this partnership will give a training to personnel, and these personnel will implement high standard of service, and this high standard of service will be welcomed by people experiencing them, and they will tell others and others, and so this will increase awareness through making a better look of the clinical practice that we do.
Mm-hmm. We also have a question from the community in the chat. How did you learn about the partnership and get involved?
Yes. Actually, this program, as Monica said, was present, and this is the third, let's say the third volume of it. And I was invited from the Ministry of Health to be a trainee within the program, together with my colleagues, and we have started our training actually many years ago, and we faced many obstacles, and we are now 2 weeks away from our graduation.
Yes, we just talked about it here in the studio with Monica. She's looking forward to the meeting in Turkey. Thank you very much, Dr. Uday Khaled. And I hear also, I think it's praying time in Baghdad, right?
Yes.
We can hear that, yeah.
Yes.
Thank you very much for being here. And to all of you, you can also write more questions in the chat. We will definitely hand them over to Dr. Khaled and try to answer them. Thank you. Thank you for being here.
Thank you.
And also the questions to Monica and to Virginia Mutheu. Please submit your questions in the chat and nothing will get lost. Thank you. Monica, quite impressive to hear the work with the Curriculum Middle East, what your colleagues are doing in Iraq and the region. I would like to move directly to your organization, which I just mentioned in the beginning, but we didn't talk about it yet. CORESZON. very special name. What is it about?
Yeah, so the name was meant to sound like the Spanish word for heart, but it's actually a kind of bulky acronym for Community Resilience Network. And just to connect what Uday Khaled was just talking about, raising awareness and getting the community involved, the service users involved in how services are delivered is such a key part of improving mental health. And that's one of the basic ideas behind CORESZON, is that for myself, having worked as a clinician for over 15 years, I really wanted to do something that works at community level also and invites people to get involved. So what CORESZON is about is training trainers who deliver a simple science-based method from peer to peer. So not from professional to service user, but really among neighbors, among friends. That's our goal. To spread this idea that informal support is an essential part of how we do mental health in a society, and to really value and appreciate that. And at the same time, to improve the connection between the community and the different services that there are, all the way up to psychiatric services, to improve collaboration, to make it easier. Because, thank you again, Uday, for how well you described the different challenges. We still have a way to go in Germany too. So that's what it's about. Yeah.
Improving the well-being on a low level, on a face-to-face level, everyday level. So maybe you can give us an idea of what such an exercise might look like, or such an encounter looks like, that promotes well-being in everyday life.
Yeah, I mean, I think we do a lot of things in our everyday lives without being actually aware of them. But if you're okay with it, I'd like to just try a little.
Of course.
Yeah? Okay,
yes,
so what people learn is how to ask specific questions that focus on well-being. For example, if you'd like, you could just tell me about something that, when you're feeling stressed out, or especially during the last couple of years that have been stressful for all of us. Can you think of anything that has been helpful for you? And if yes, would you like to tell me about it briefly?
Yes, of course I can do so. What really helped me was going into nature, going for walks. I think that's what most people did. That was the only thing that we were able to do during the pandemic. But nature really helps me to feel grounded and feel the connection, and also feel the connectedness with nature and as a human being. So this is something that really helps me, going in the woods for a walk or in the park. So this is what helps me.
I mean, even if you're just telling me about this, I could hear your voice getting a bit calm, a bit quieter. And I wonder if you just take just a tiny moment just to notice, when you talk about this calm and about this stillness, what does that feel like?
I feel like I can breathe more easily, and like the breath is flowing naturally. It's something that, as a human being alive, breathing is going naturally. That's what I can now, if you ask me, just observe.
Wow. Okay. Thank you, Miriam, for this little example. So this is just for those of you watching. Actually, how the method works is we ask each other questions to remind each other, what does well-being feel like? And by having conversations about this and noticing, not just by giving it names, but by noticing what it feels like, we can actually intensify that experience. And so there's a lot of current neurobiology behind the method that we won't get into here. But what we do know is that it helps people connect. It helps people share resources, share strengths with each other. And we're pretty sure that it helps people cooperate well with each other.
Yeah. But do you think it's easy for people to really observe what they feel? Because I think talking about feelings and what is really well-being about is sometimes difficult,
yeah,
right?
It's personal and it's difficult. And, when do we take time to talk about well-being? We talk about stress all the time, but we rarely talk about, what does feeling good feel like? No, it takes practice, and that's why we do these courses. And that's what our trainers, people who train as Corazon trainers, are specialists in, is teaching people how to shift their focus and have enriching conversations about well-being.
Yes, very, very interesting and quite hands-on. It's there is no huge theoretical background. I mean, there is, but
there is
you don't need it to feel the connectedness.
Yeah, it can be very deceptively simple.
Yeah.
And, we use it in our hospital, and people use it at the kitchen table.
Yeah. Yeah, there is a beauty in that simplicity, really. I can feel it right now in this interview.
Yeah, I think Virginia is probably even better at getting that across because,
we'll talk about the garden method. Yeah, that is a method that is also very, very hands-on, I think, and your project, as you said, grows through that community-oriented workshops and people who are interested in well-being, in helping, in developing also their own personality and their own well-being. And this the trainer method that you developed, so everybody can learn the method and pass them to others. And now I would love to have Virginia Mutheu here, but we also, hi Virginia, welcome.
Hi.
Hi, welcome. We have a few pictures of you so that our audience, the community can also see you guys in action. Maybe we can share those pictures first.
Yeah, so this was just after we completed a successful workshop for 2 weeks for trainers of trainees, and also another organization we were qualifying also to be trainers of the garden method. This one is where Monica came to Kenya, so she was just from the airport and she was still in that travel mood. So we were doing a session so that she can calm down and she can come back to the cab. We call it the cab.
Okay, so you just arrived, Monica, and there was Virginia Mutheu and offering you the garden method to feel better.
Yeah, that's the great thing about how these peer-to-peer things work.
Yes. Virginia, I would love to hear more about your work. So you're a project coordinator of Shining Hope for Communities, SHOFCO, and in this organization you're responsible for projects that strengthen mental health of slum dwellers, and we're talking about a huge community in Nairobi. I think about 60% of Nairobi's urban population that lives in slums, and so this is the work that you're doing there, and I would love you to give us more insight on the living conditions and the mental health situation of the people living there.
Yeah, thank you so much, Miriam. So, as you've mentioned, I work with SHOFCO, Shining Hope for Communities, which is working in urban slums in Kenya. We actually not only in Nairobi, but we've also gone to other areas in other cities and also in our rural areas where we're also working with the people living there in economically empowering them. And we are integrating the mental health program in all our programming. So we have the school, we have health programs, we have community development programs. So we make sure every beneficiary coming through our program is able to be part of mental health, so that we create awareness and also we help people deal with mental health issues.
Can you give us more detail on the partnership? We saw the pictures, very nice, the cake, which is also part of well-being, for me at least. So the partnership of SHOFCO with CORESZON, the hospital partnership, please give us more information on that.
Yeah, we started our partnership with Corazon years back in 2019. We had our first cohort where we were introduced to the garden method and how we can relate mental health to a garden and how best we can integrate it to the communities, and also how best we can explain it to the people we serve in our communities. And since 2019, we've been working closely with Monica, who have come to Kenya several times, and we've been able to train trainers who are implementing these programs in the communities where we serve. So we've had trainers who have graduated to be trainers of trainers. And going forward, maybe with time, Monica won't have to come to Kenya to train other trainers, but we'll have our own trainers within SHOFCO who are able to train even other organizations, creating more partnerships even locally, and being able to also have this program being run by other organizations, not necessarily her. So this partnership was purely because we realized in Kenya the mental health status, it's very bad, and like in 10 people, one is suffering from a mental health condition. So you can see the numbers now. It's very high. And being in the slums and the living conditions of people in the slums, people living in 10 by 10 houses and have big families, and they have other challenges, and they are not able to provide well for their families, their sanitation, their health. And there are so many other things affecting their mental health. So it is very important, and so it's very important for us to start this partnership with Monica, with Corazon, so that we can also not only talk about community empowerment, but also make sure people are mentally well, and we also prevent the severe outcomes of not taking care of yourself, like the self-care. Yeah.
And what do you think? We just talked to Dr. Khaled about the awareness for this topic. What do you think is the status of awareness for these mental health issues in Nairobi or in the regions that you work in?
Yeah, generally in Kenya, previously mental health was like a myth, and people were believing that it was something maybe you have been waged or something like that. But nowadays, even the government has established a committee which is come up with a policy where we have commitment now that they are focusing on attaining the highest standards of mental health through the government. So we have a policy, we have a task force which is in charge of discussing these issues and making sure that we have budgets for that. So in Kenya, we can say we are already making a step.
Mm-hmm.
Yeah.
You just saw Monica getting into an exercise with me from the toolbox of the Corazon methods, and we also talked about the garden method, and I would love to hear from you what is the garden method and how does it help people?
Yeah, so the garden method is a technique for one to do self-care, and it's something which is so easy to understand and to also relate to, because when you talk about mental health, you find like so many terms, medical terms, other people won't be able to understand. But when you talk about cultivating a garden, it's something everybody can relate to, even the kids. They can also relate to a garden and how you can maintain your garden and how so we translate that to ourselves.
Yeah, I think we also have photos, Ms. Mutheu, right? That show.
Yes, we have.
Yeah, let's share the photos so that we get an idea of how this method works.
Yeah, so in this first photo, because we work in the community, so we have women programs, so we mobilize the women because we think when you talk to a woman first and tell her about this, she's able to take care better about their family and also pass this information to others, and she's also been able to guide others. So this is a session with community members discussing of their sources of knowledge from our different programs. Sorry for that. I hope I'm back. So in that photo, we are talking about youth, with youths who are seeking employment. So you see this process of seeking employment, you're stressed, you don't know how to react when you are asked difficult interview questions. So we talk to them about calming down, being able to release stress, signs of stress, if they are stressed, how to identify when you are stressed, when you are in high zone, when you are in low zone, and when you need something like first aid to come back to the normal. Mm-hmm. Yeah. So we have also partners we work with. So we are having sessions. We also have sessions with them regularly. We also want them to go in the organizations they work with, and also, if possible, they invite us for sessions, and also for them, for the knowledge they have gained from us. This is one of the partner sessions where I think I was talking about something. So how I release my stress.
In action.
Yeah, so they are able to go and also replicate the same in the organization.
Mm-hmm. Thank you. I think we have questions from the community in the chat. I will read them for you. I need the questions on the screen so that I can read them. Yeah. Monica, the first one is for you. Is it possible to convey knowledge for non-professionals, mothers and teachers, coping strategies for stressful situations?
Oh, yes.
That one is for you, and yeah, the second one is for Virginia Mutheu.
Yeah, okay, I'm sure Virginia would have a lot of answers to this one too, but of course, it's absolutely possible, and it's actually quite beneficial to professionals to do that, because when we share knowledge with each other, we learn about what's already working well, which is important for us who are in kind of the clinical service area. What's already working well is a really important question. And I think that also when we're teaching about these kind of things, it's really important to make it practical, to make it hands-on, and to make it really relate to people's everyday lives.
Yeah. I would also love to hear your perspective, Ms. Mutheu, on that question.
Yes, I think it's very easy to relate with the community, because we are in the ground and we know what they are going through, and also because we are talking about practical issues, their life, day-to-day life. So they're able to talk about the experiences, find their own sources of nourishment, and they're able also to do the first aid themselves. So it's something very easy, that because it's not a lecture method, it's a guiding method, like a person to person. So you are able to relate very well, because even for us trainers, it's very easy, because when I'm talking about it, I'm also doing self-care myself. Mm-hmm. So it's I can't actually guide somebody when I'm not well.
Mm-hmm. Yeah, and then we have a second question. Virginia, how did CORESZON and SHOFCO come together for partnering? Oh, it's to both of you. Maybe Virginia, you can start, and then I can hand over to Monica.
Yeah, so we knew CORESZON through a friend of our CEO, Khaled, who met his friend in Germany, and they were able to converse about the situation in Kenya and how mental health is affecting people in Kenya. And it happens that his friend also knew about hospital partnerships and CORESZON. So that's how we connected.
Mm-hmm.
Yeah.
Monica, anything that you want to add to this
I think
story?
Another part of the story is that the Peter Merle Foundation, a private foundation in Germany, they're actually our founding partner, and also support SHOFCO. So by bringing us together, they enabled us to get started in a way that helped us reach a point where we could go into a hospital partnership for the next steps. Yeah.
And what do you wish for this flourishing partnership, both of you, in the field of mental health?
Okay, so is it okay if I go first?
Yeah. And then you.
Okay. All right, so for our partnership, first, I love that Virginia mentioned this, that, you know, what we're really working towards is that the SHOFCO team will be able to carry on without me, because that's the best indicator of project success is when I become redundant. So that's one thing that I'm really looking forward to, only coming to Nairobi to have cake. And then for the field of mental health in general, I think there's a really great need to look closely at how these community-based interventions work and how peer-led change in the field of mental health can work well. And I think we're making some headway there because this project is growing. It's growing healthily, and I think that's what the hospital partnership is really helping us do.
Yeah, thank you. Ms. Mutheu, what is your wish for the future?
Yes, I think Monica's summed it up, but I would wish also, because it's growing really very fast, and also we are getting so much positive feedback, and we are already seeing the impact of this program. So we wish to make it bigger, and also to get more partners also who can support us to pass this message and also to grow the partnership. Thanks.
Thank you, Virginia Mutheu. Thank you, and greetings to Nairobi, Kenya. Thanks for being with us.
Thank you.
And again, to you watching this live stream, you can write your questions in the chat. We will hand them over to our three guests. Nothing gets lost. Monica, we're almost done with this live stream, but before we wrap up this session, I would like to know, so there are currently 15 hospital partnerships working in the mental health field. What do you think hospital partnerships can do for global mental health?
Yeah, so we were lucky enough to have a meeting where some of the 15 partnerships were actually represented, and one of the takeaways that really stayed with me was that by pooling our knowledge, not just as the German partners, but with our partners in other countries, we can actually look at how the training activities that we do, how to make them work well and how they can maybe be applied in other contexts to really learn from each other in terms of capacity building. Because there's so much experience being gained in this field. And often I think, it's really important to look at the content, what is being passed on, but I think we also really need to focus on the how. How is it being done? And with these 15 partners who are working in the field of global mental health, if we put them all together, there's a huge opportunity to look closer at the how, at the implementation level. And I think that could be a valuable contribution to global mental health, because there's so many programs out there that work well. The only question is how to make them work.
So we have two more questions from the community. How do you adjust such a program like Corazon to other countries, like Vietnam, for example?
Right. Oh, okay. This would be another one for Virginia, actually, because she's actually one of the people adjusting it to another country in Kenya. So really through partnering and through focusing on, these are the target outcomes, but there are lots of ways to reach these outcomes, and really working together, but also handing over the methodology for our partners to develop and adapt to their context. That's one of the most important parts of integrating Corazon in the way that our colleagues in Kenya are doing.
And we'll definitely hand over this question also to Virginia Mutheu. Beautiful and important work, writes this person. Could you elaborate more on concrete next steps, milestones, and possible challenges?
Yeah, there's so many to do at a different level. I mean, I think that we're reaching a really important milestone next week. Virginia and the team in Nairobi and I, with their graduation as trainers of trainers. So that will be a huge milestone. And I think connecting what we do with other organizations is important. So networking, as Virginia already mentioned, and also connecting perhaps with universities or other institutions that can help us measure the impact of what we're doing. I think that's also an important level. And luckily, SHOFCO is already quite well connected with the Ministry of Health. So I think that will also be another key part of is bringing in the mental health piece of SHOFCO's work to see how we can scale or how we can share what the team has developed with others. When I say we, I actually mean the SHOFCO team. I'm just a happy onlooker at that point, probably. Yeah.
What would you say as a wrap up, your main takeaway from this partnership journey? What would you say is your main takeaway?
I think it's just it's an extremely rich learning experience. And I think for anybody who works in the field in health, doing a partnership like this is really a great opportunity to, well, I think I usually come back more inspired and more motivated after working with our hospital partners. I think that's one really important thing, to kind of really believe in what we do and have the courage to try to make changes and develop continuously, like a garden.
Like a growing garden, and which also shows the beautiful logo of this hospital partnerships. Thank you very much, Monica Blotevogel. Thank you very much, Virginia Mutheu. Thank you, Dr. Uday Khaled. I hope you enjoyed this live stream. The next one will be in May here on YouTube as well. You will get all the information on the website of the Hospital Partnerships program and on Twitter, of course. And the live chat will be open for a while so that you have the opportunity to write your questions, or maybe something came up that you want to know. The team behind the scenes will manage to pass the questions over. Thank you. This live stream will be recorded and made available on YouTube. And it was a pleasure having our three guests here. It was a pleasure having you here in Bonn in the studio. Many greetings to Dr. Khaled and Virginia Mutheu. Thanks for being here.